Hello everyone, welcome back to my channel. Today I will show you a classical case of MORTON'S neuroma. It's not a tumor condition, but it's a painful condition that occurs in the foot of the patients. The classical area where the pain occurs is in the interdigital area between the third and the fourth. If you can see these metatarsals, these are the tarsals, metatarsals and the distal bones. So the classical area where the pain occurs in such group of patients is mainly between the third and the fourth interdigital cleft, right? So the patient will say that he or she feels burning type of pain and difficulty in walking, especially during the day hours and the active hours. Why this pain occurs? This pain occurs because of the thickening of the tissues between these metatarsal bones. These tissues between the metatarsal bones get thickened and the nerve gets entrapped between those thickened tissues. These nerves are the plantar nerves, right? So the pain is predominantly on the plantar aspect of the foot and also on the dorsum of the dorsum of the foot as well as on the plantar aspect of the foot. On the plantar aspect, the pain is predominantly on the ball of the foot, this area. How do we elicit this? I am just pressing in the area between the third and the fourth interphalangeal space.
पेन हो रहा है सर.
पेन हो रहा है?
हाँ सर.
ज़्यादा पेन हो रहा है? अभी
इतना नहीं.
अभी
हाँ सर, पेन हो रहा है ज़्यादा.
अभी पेन हो रहा है?
हाँ.
So now he is complaining of pain when I am putting some pressure in the interdigital area between the third and the fourth distal fingers, right? Toes, sorry. So what we do now, I had given him a conservative trial of 7 days with some anti-inflammatories which has not responded well. He is still in pain and he has missed his exam also because of the severity of the pain. So my next job is to go for local site infiltration of steroid, which I will use triamcinolone 40 mg. I will use a long acting one, hexa, triamcinolone hexa, along with supplementation of ozone. That is the next line of treatment with following failure of anti-inflammatories. So now let's see how we proceed. Yeah, maximum जो था से कोबा.
इचुल maximum नहीं.
Okay. So this is the 40 mg triamcinolone injection which I will be injecting in the space between the third and the fourth interdigital space. Beji लगाया है, I am putting the injection. Okay, this is the cleft. I am just putting the injection. Ozone. So this is ozone, 10 microgram per ml. I will inject 50 microgram. This is usually the standard which I follow in my practice. I will supplement this with ozone.
Start.
So I have injected, the procedure is completed. I hope he gets relieved of the pain. So I will give anti-inflammatory for another 5 days with certain advices. The important advices are, I will ask him not to wear shoes containing heels, number 1, and shoes which are pointed on the front side. Those kind of shoes should be avoided. Instead, I will ask him to wear open-ended sandals from both sides for few days. And let us see how he behaves to this injection and to some drugs in the future. Thank you so much. This is MORTON'S neuroma. Thank you.